So good afternoon, everyone. My name is Jill Nimchak. I am with the Wisconsin Out of School Time Alliance. That's a program of the Marshfield Clinic region of Sanford Health. I want to welcome you today, today's webinar on empowering after-school programs, really navigating policies and procedures for addressing social determinants of health. That's kind of a long statement, but we're really going to be talking about kind of policies and procedures of needs assessment. This webinar is part of an ongoing social determinants of health series where we have aimed to provide you out of school time folks with strategies to support your youth and families. We really hope that you leave here today with a few more tools to help you navigate these situations with greater confidence. This series is made possible through a partnership between the Wisconsin Out of School Time Alliance and the Wisconsin Department of Children and Families. I am pleased to introduce our speakers today, Jenny Meldy and Emily Pyrick of the La Crosse YMCA and Lindsay Pearl of the La Crosse United Way from the Hub program. So I will turn it over to Jenny and crew.
Thanks, Jill. We're really excited to be here. You can see I'm Jenny, and then Emily is with me in the room, and then Lindsay is also the other person on camera. So while I'm getting my screen ready to be shared, I'm hoping that in the chat box, everybody could share a little bit, you could share, we can see your name, but if you could share what program you're with, what part of the state you're from, that would be just really great. I'd love to know who I'm presenting to. So what kind of program you're with, where you're from in this state, and then I will get my slides shared and ready to go. So if you can enter that in the chat box, then we'll start in just a minute. All right, well, welcome to this presentation of social determinants of health and the, intersection with out of school time programming. I would really, the next thing I would like is for you to put in the chat box. Lindsay and I were like, how much do people know about social determinants of health? And so we're thinking on a scale of 1 to 5, if you could put in there 1, like I'm a beginner. I don't really know what SDoH stands for and would love to learn more. Or 5, hey, I'm well-versed in social determinants of health. So if you can put in the chat box, okay, Lindsay, I'm seeing lots of 1s.
Yep.
So
Great.
This is great. So I'm going to turn it over. Let me just show you who we have on the screen so you can see this is all of us as Jill introduced us from the La Crosse Area Family YMCA. And we work very closely with the Great Rivers United Way Hub to support our community health workers. And we'll talk about that a little bit further in the presentation. So starting out, I just wanted to share that none of our work in out of school time, and many of you know this, wouldn't be successful without partners. And so partnerships are so important to our work, and especially here at the La Crosse Y. We often say collaboration or partnership is our middle name at the YMCA. So I just wanted to throw this up here so you could see who all of our partners are that we work with. But we're excited to have our special guest of Lindsay from the United Way Hub to really educate us and teach us about social determinants of health. So Lindsay, I'm turning it over to you.
Yeah, wonderful. And thanks all for sharing where you're at on that scale of 1 to 5. That's helpful, and excited to talk about and introduce social determinants of health. So what's on the screen right now is from Healthy People 2030. It's really what government websites are going to be using as what defines social determinants of health, but there's a lot of different ways to talk about this. And one of the key kind of definitions or ways to describe social determinants of health is it's the the environment that impacts our health. Another way to say that, it's where we live, work, and play. Those are those spaces that we're in, and the environment that is created there, the circumstances of those various locations impacts our health greatly. And I think if we reflect on our own lives, we know that very much. The stress of having something happening with our home, or if there's a crisis situation going on, if we have financial trouble, all of those stressors are going to impact our day-to-day and ultimately our clinical health. So not just the stress compounds that, but environmental factors like the health of the water system that you drink from. If you have well water, are you checking that? We can think about Michigan, Flint, Michigan, with lead in the water, right? Those are environmental factors that absolutely contribute to somebody's health and well-being. And so there's a lot of data that's been collected over years to really point to social determinants of health being a very monumental contributor to health outcomes. So not just what happens in the walls of healthcare, there's only so much influence, our genetics have, but social determinants of health increasingly we're seeing has such a huge impact on our health well-being. And for children, ultimately, behavior also comes into a role here. But this is the model, and so we think about a couple different categories. So education, access, and quality. Research is very clear. The higher education is associated with better health outcomes. That doesn't mean that everyone needs to pursue a PhD, but it is showing that there's a correlation. And so even at our youngest ages, being engaged in school, and there's other factors beneficial to that, and that's in the social category, that's going to contribute to better health outcomes. Healthcare access and quality. You might think of this as clinical, but we're talking specifically about being able to access healthcare. That includes transportation. It is talking about proximity. It's talking about health insurance, being able to afford healthcare access, and be able to afford something that's of quality care. And so that's a social determinant of health alone, besides actually getting into the doctor and what the doctor does within an office visit. Neighborhood and built environment, I reference this as well. We're talking about homes that folks are living in. Are they safe? Is there lead in the drinking water? Is the drinking water safe? These are pretty basic ideas, but also we can talk about roads. Are there bicycle paths? Are there physical activity locations that are safe also for families to engage in? This is going to impact health. This also comes back to food. Food deserts are exactly part of this built environment piece. So are individuals able to, in their neighborhood, access healthy food or not? And probably, an area that we'll talk about later as well. And then social and community context, belonging is such an important aspect of being a human being, and social connectedness as well. I think we all can relate to that. And so obviously we'll have a big impact on our resilience to adverse experiences from youth through adulthood, but also is going to help drive our involvement and overall health and well-being. And then, of course, economic stability. I don't think we have to even put much thought to it to imagine how our finances are going to impact our choices and our health outcomes. This, again, ties right back to healthcare access. Do we have to make decisions about which medications to take or not because of our financial economic stability? And so when we have that stability, we're going to be able to access things in our best interest versus if we have to make those tough choices, right? And so these social determinants of health all together really create this sort of a wellness wheel, if you've heard of that model, where if we are sort of low in any of these categories, it is going to impact us. And many of these are interconnected. So we are not just going to say somebody just has economic instability. If there's economic instability, likely many of these other categories are impacted, and therefore the domino effect, so is our health. So when we're meeting in the doctor's office and they're asking us to do XYZ for our care plan, we might not be able to do that because of these other social determinants of health getting in the way. So that's kind of the basics of social determinants of health and how it impacts. And so another way to think about this, and Jenny will go to the next slide, we like to think about this in sort of an iceberg type of way of thinking. So, we can see an outcome here. Right now we have on there the tip of this iceberg is families experiencing homelessness, which is a group that our Y partners are working with. That's just the tip of the iceberg, literally, right? There's a lot of underlying factors that are going into this family and the decisions they're making. But we can also insert in that box something else. We can insert that with type 2 diabetes. That might be the outcome, but there's so many other factors that went into that health outcome that is contributing to how people are making decisions, how people can or cannot navigate out of a situation. And so all of these, and mostly below the surface here, is mostly social determinants of health. And so these are all going to weigh in. You see the type 2 diabetes is down there without listing it. We're talking about healthcare access. What about medications? Are they able to manage that? How is their type 2 diabetes managed or unmanaged, impacting the way that they can show up for their family? So all of these are going to contribute. And so when we're thinking about our programming and when we're thinking about how are we addressing things, we're really thinking about, okay, when we're looking at this one issue, we have to acknowledge that there's these other underlying issues, because otherwise, what has historically happened, especially when we're talking about clinical pieces. So if we said the tip of the iceberg was unmanaged diabetes in this case, sometimes we might see a provider saying that somebody isn't following their care plan, or they're not willing to, right? But the problem is we might not be diving below the surface to see what the contributing factors are to someone being unable to really meet all the expectations of a care plan. And this might be the same behavior. Children's behavior is another really good example. You see behavior as the tip of the iceberg for a child. There's going to be underlying factors that led to that moment, that behavior. And so if we're not looking under the surface, we're not preventing future behavior. We're not preventing future crisis. We have to dive deeper to really understand and treat somebody holistically, because our lives are interconnected. Even though there might be programs here focused on this, and we need that. We need programs that are specially focused and experts. And also, we have to acknowledge that a human's life is interconnected. They're not only going to be at one program for one thing, and that's all that they need. That's not how our lives work. And so we can't really expect that either. So we need to keep this in mind. And that leads us to assessments. And so assessments can be a really important tool to help us dive beneath the surface. So we have a couple pretty regular tools here on the screen. The Prepare tool is used in clinical settings across the board. There's more nonprofits picking this up. It's a pretty standardized tool for identifying some social determinants of health. There's also the HRSN. That's from the Center for Medicaid and Medicare Services. It's a health-related social needs screening tool. So these are standardized, validated tools to help you dive a little bit below the surface. But the thing about assessments is that what we hope that practitioners are doing when they're thinking about adapting an assessment is that we're thinking about what's next. Because a lot of the families that are coming to us have already been screened, right? They've been sharing their story over and over. And so in our partnership with the Y and our community health workers, which we'll talk about, we're really trying to keep that in mind. The folks are being asked questions over and over for any programs they're enrolling in. And so the question on our side when we're thinking about assessment and a policy around that is, what are we responsible for? What are we doing? And let's make sure we're just collecting what we need to do our role. And so is the role knowing resources in the community to provide referrals for, or to provide information for? Are we seeing that many of our families are coming to us maybe with some food insecurity, but also X, Y, and Z? And so we want to have those partnerships to the table, or we want to have those resources at the table to give out? Or is there programming that you can provide that can wrap around a certain social determinant of health? Again, food being an example, food insecurity. How are we making sure that we're addressing that, filling that need with or without an assessment? So you can use a formal assessment to help you guide that policy. It can help you collect that data to see what are the gaps that are being seen and how can you build a more robust program to help support maybe some, no way you're going to address all, or one social determinant of health that's coming up. But also being mindful about, are you collecting data to collect, or is there something that you'll do with it? And so that's a really key aspect to us as we're devising our questions. We don't use these in our program. We have a standardized tool that we use. We call it a checklist, and we have our community health workers trained on that. And each of those data pieces are either helping the community health worker identify specific things to work on with that individual, or referrals to send them to, or it's helping contribute to larger data that we're able to share with community about gaps in services in our community. So really intentional with what is being asked in that way, so that we can make sure that there's follow-up and we're not just asking to ask. And I think that's another piece of assessment, is who's doing the follow-up. So the way that we work, and we'll go to the next slide in just a second, but is community health workers. That's okay, Jenna, we can go there too. Is we leverage partnerships with community health workers, and I'll explain who they are in a second, but making sure that we are having someone who's working with somebody in the home, working alongside someone really to understand those social determinants of health, also at a cultural level. And I think that's what sometimes is missing when we look clinically at the Prepare tool or the HRSN or other social determinant of health screenings that's coming up. We're very happy to see that coming across healthcare, because it's important for healthcare to recognize and look under the surface, as we've been talking about. But without a follow-up, without that context of culture, there's no next steps. And so if somebody says, on a screening that their only need is that they have financial insecurity, let's think about that. The domino effect of financial insecurity, right? You're not just only going to have that you need money once, right? You're going to have other domino effects that are going to impact you. Are you making choices about medication? Are you having to make tough choices about the food on your family's table? What about your rent? Are you behind on that? And that quickly snowballs into a lot of different issues. And so, yes, somebody might only say one thing, but that comes back to trust. And that's where community health workers come in for us. So community health workers are frontline public health workers. This is the APHA definition. And they're trusted members and usually have a close understanding of the community they serve. So what we mean by that is not usually geographically from the community that they're serving, and also culturally aligned or lived experience that it aligns with the folks that they're serving. And this allows the community health workers to really build trust a lot more quickly than someone who isn't understanding of them. And I think we can all relate to that. When you're talking with someone who really doesn't get where you're from, right? You're not going to trust them as quickly as someone who you are immediately, I'll call it vibing with, right? Where you're immediately that they understand you, you understand them because you have that shared experience or background culture that you can share, and you have your own language. And community health workers are that as well, because we don't have built communities where neighbors are doing this for each other really anymore. That's a rarity. And so community health workers help fill that gap in a way and help provide that informal social support, that trust building, where we can be in home, the community health workers can be in home, in community, really truly understanding the different threads of these social determinants of health, where people are living, working, playing, and be able to relate to that person. And because of that trust, the community health worker is then able to help increase health knowledge, really meeting that person where they're at, and help bridge to self-sufficiency and it lists a couple different things here. So there's a number of different ways for community health workers to do that. And so when we are looking at assessments or identifying social determinants of health, we pair that with community health workers who are going in home, identifying all of these different needs, forming a plan to address those needs very specifically in a culturally competent or culturally way. And so then we're making sure that they're getting their needs met in a way that's comfortable for them, that's trust-based, and strength-based as well. So making sure we're looking at all of those things. With that, I think what we're going from here is to send it back to the why here to kind of drive home some actual examples of all of this in play.
Thanks, Lindsay, for that explanation. And I just love listening to that and the reminder of all the work we do and the day-to-day that we do to, and like you said, dig deep in the surface or below the surface. So thank you for sharing that and educating us more on social determinants of health. It really validates what we do in our programs. I wanted to jump a little bit specifically as to follow up to Lindsay as she was talking about community health workers at the Y specific at our Y specifically. We have a partnership with the Great Rivers Hub and a system and a more structured program around community health workers where the hub is getting referrals from families. And from the school district, from the community, from community social workers. And those referrals then are sent from the hub to our community health workers. And you can see this is a picture of our wonderful three community health workers. We have Emily, and Saled. And their primary role is to educate, navigate, coordinate, and advocate. And so those are the themes of community health workers. And we really think about this as wraparound support for their lives, that, addressing those needs that are below the surface. And so specifically, we're working in partnership with school districts, or elementary students who are chronically absent, and then other families that might meet a certain protocol who need support. So that's specifically how RY addresses and utilizes community health workers and uses the Great Rivers Hub model. I'd like to go next and share just some more keys to success when we think about all the programs that I'm going to share with you and how RY operates in order to support families and support our community. I identified these three keys to success for all the work that we do. And so I would just ask you to, think about how does this look in the program or the department or your future career that you work within. So we at the Y, I oversee a team, a community outreach team of amazing, powerful, strong women who are dedicated to their different areas that we'll talk about. But one thing that we do and be successful for all of us to work together is to really have a collaborative internal feel and a collaborative culture externally. So we really are always thinking about how do we work with each other and with others who, might be outside of our departments, might be outside of our community outreach, but might be outside of our whole entire organization. We also want to make sure that we always have an eye on continuous improvement. So whether that's working with one individual's needs, maybe that's one child, one family, one client, or whether it's a whole program like our out of school time program or our food access work. What's going well within that? What are the challenges? And then what's next? What else can we do? So we're continuously learning, improving, learning, and improving. And then the third key to success, and I mentioned this at the beginning, is partnerships and that foundation of what is a partnership? What can we do to complement what's already happening in our community? How can we address gaps? And Lindsay, mentioned that too, of like they collect a lot of data to look at what are the gaps on a large scale, a collective front, but also thinking about like, what are the gaps in services or partnerships that might be out there? So we often think, oh, how can we complement with this organization, this agency? If they're already doing it, then what can we do differently so that we can maximize our efforts in the community? And I just shared a little, a small example of that in our communities. We have this back to school initiative, and it is a collaboration of all kinds of organizations who are working together. We meet monthly. We talk about, hey, what back to school efforts are you meeting? What families are you serving? What day and time is your event, so that we have an event on a day and time that's different, or we can access resources differently, so that, again, we're maximizing our outreach in the community. So culture, continuous improvement, and partnerships are, I feel, the keys to success. So like, what I'd like to do now is share more specifically examples from our organization and our association in the realm of out of school time. And I think that, I think WASTA has done a really good job of like expanding our lens and our definition of out of school time. And when we think about what we do at the Y, we really take it very literally. What is out of school time? Literally, there's bell to bell. What else happens? And so these are examples of things that we are programming that we consider out of school time. It's things that happen after school, before school, in the summer, on the weekends, evenings. And so just looking at this sort of comprehensive approach to out of school time. So the first one I wanted to share with, and if we think about social determinants of health and really going under the surface, I just want to share what that might look like in our more traditional before and after school or summer day camp programs. So again, community partnerships, we work directly with school districts. We are within schools. We're in the schools in the summer, we're in the schools before and after school, and we're working specifically with children. We're trying to mesh expectations of the school day with out of school time. But we're also going, hey, we're a little different than school. We, of course, want to support their academic and their learning, but we do that with social connectedness. We do that with, what are those opportunities outdoors? How can we have our kids, we serve 5 through 12-year-olds. How do they learn from the 12-year-olds? How do those youngers learn? So really thinking about our staff development, educating and leading our staff is so important. How do we weave in mental health supports and social emotional learning in our before and after school, so that we're so much more than just a place where kids go before or after school or in the summer. We also do a lot with our staff in training them to really engage with families, not just the children that they serve, but the family as a whole, and really then identify those needs, share those, and that culture of how do we talk to our supervisors? How do we talk to the other departments to meet the needs of the children who we might be serving in our programs? Another example, and something that I would say is our non-traditional access to out of school time. So we have a program called Y on the Fly, full of activities and food and fun that we take out in the community. So one of our partnerships, we were working with some low-income housing neighborhoods with the housing authority, the school district, neighborhood police liaisons. And we identified in that group with other youth serving organizations like the Boys and Girls Club that there was a need for access to things on the weekends and in the evenings. How do we beef up our family nights that they're having, and how can we all come together? So we identified that, and now on Sundays, we are out in neighborhoods. We're offering out of school time. On Sunday, we're doing physical activity. We're out at events where we're engaging youth to come through the summer. They come and get a meal, but they also get activity and social time with others. So, taking the Y and our programs outside of the walls of a traditional facility. Another area, a huge and growing area, and many of you can probably relate or understand this, but we had been doing some outreach food programs. We've been feeding the kids within our traditional before and after school and summer day camp programs for years. And then we started to reach out and we started to serve meals at other youth serving organizations, like the Boys and Girls Club or some local nonprofit organizations. We started serving meals at libraries. And then we started to expand into parks. So how can we create access to food? Because not every child is enrolled in a structured summer camp program. And maybe they don't have the access to that. Maybe during the school year, they're getting free breakfast and lunch and a snack every day. But what happens nights and weekends during the school year, or just during the day when they all summer long? And so our food access programs identified the need of, hey, we need to serve more families. We identified transportation as a lack of access. And so we started a food pantry. We call it the mobile market. We take referrals from different community health workers and different agencies of families in need of a monthly food box. And then we put those boxes together. And because we have amazing pantries in our community, we identified transportation as a gap. And so we're delivering that food. We're getting out into the rural community. We're able to serve adults and other members of the family alongside our traditional out of school time food programs. And so one thing I wanted to share, and some of you might be involved in programs that are related with school programs, but the National School Lunch Program that reimburses schools for breakfast and lunch, they can serve a 2-component snack in the afternoon. And many out of school time programs take advantage of that. But one thing that we identified because of our out of school time programs, we're taking advantage of the child and adult care food program. And at our neediest schools, those schools who are 50% free or reduced meals, we can actually serve a meal and a snack. So we can serve a 5-component snack and be reimbursed through the child and adult care food program, just like schools are reimbursed for their lunch programs. And so that has been a piece of our food program that we've been amplified, that we've been able to amplify our out of school time traditional after school programs. We're serving a full meal at those sites that qualify. So food access is really huge and growing need that we're hearing around our communities and around the state. Another way that, and another, more non-traditional out of school time program we have here at the Y is we actually have a youth center. It serves 10 to 17-year-olds after school, weekends, and all through the summer. This again was identified that we had youth within our Y building who weren't a part of a structured program, and they were struggling with wanting a place, wanting to belong, as Lindsay said. They wanted to belong. And we're fortunate that we own a standalone facility that is built as a 5,000 square foot house. So you can see the picture in the middle is the kitchen and the kitchen table. They covered in aluminum foil. They were having nachos that day. We also have an art room. We have a living room. We have a game room, which is our game room is like cards and puzzles and board games. We also have a technology room that we use within our youth center. And what we identified is that there were gaps in our community on youth serving organizations on the weekends. So we are open 7 days a week. We serve, like I said, those 10 to 17-year-olds. It's free. It's a drop-in program. So youth sign a waiver, they sign up, but they're free to come and go. They don't have to sign into the program, sign up for certain days. They are free to drop in. And we definitely identified transportation. So through generous donations, we do have 2 passenger vans where we are transporting children after school. We bring them to our youth center and then we take them home in the evenings. But then also in the summer, we're going out to different neighborhoods. And on the weekends, we're picking up children in different areas so that they can make their way to our youth center. So that's another more non-traditional approach. And, when we think about financial access, when we think about social connectedness, when we think about just really getting to know the youth and what their needs are, this is a place where we really focus on engagement. we really focus on staff training and development so we can identify those needs and get the families of support. Many of the youth who attend our youth center are on a higher need basis. In fact, some of our community health workers, they might be working with a family who's experiencing homelessness. So this is a great place for those 10 to 17-year-olds after school when they don't have a place to go, that they can come here and have a home-like feel, and they can get a good, healthy meal in the evenings. One other, we want to also impact, the physical and mental health of all of our participants in all of the programs. And we have really made a dedicated effort to embracing the mental well-being of our participants. We're fortunate enough to have a mental health director within our association who works across the board with all of the programs I shared with you, but also within our membership. And so I would encourage you, not that everybody has to have a standalone mental health director, but Anna's role is really to be out in the community and partnering with different coalitions. And so there's a lot of networks in your community that have resources available. She's working with our members and our family engagement. She has really worked with an AmeriCorps member to bring social and emotional learning and curriculum into our traditional out of school time programs, into our youth center, and within our food program and our mobile market. Like, we're sending out resources that she's helped develop. We have a food for thought newsletter. And so she's helped develop that we're able to put in our mobile market food boxes. So really approaching, supporting family all across the board. She also takes the lead on some staff and volunteer development so that we're training our staff and volunteers on how to engage, how to identify, how to work with youth. And then, hey, if we're then seeing needs arise or specific concerns, she can help support those specific concerns, but also we're just providing an equitable access to mental health supports and ways of working and advancing those skills. And then before I turn it over to Emily to really share some, examples of impact with our community health workers, this is just another way that we embrace at our YMCA. Our community health workers have really helped us identify needs in the community, which led us, we had a room that was in the lower level of our youth center that was very underutilized. And we identified a need, not only for community health workers, but clients, but others in our community. And so we have a full-fledged clothing closet where we take donations. And then we have different agencies and caseworkers who can sign up for times to come to our community clothing closet. So we have all genders, we have all ages, infants all the way on up, of clothing, accessible shoes. We also have a hygiene sort of pantry with that. And so really helping support the resources. We also, because it's located in our youth center, sometimes we have youth who we might notice there's a need for a new pair of shoes, or maybe there's some hygiene items that maybe they're lacking at home. And so we're able to support the youth by taking them downstairs. They can shop or find some clothes. We also have a full shower and bathroom facility in the basement of our youth center. So just seamlessly weaving it into our program is our clothing closet. Our community health workers work very closely with our food access director and identifying emergency food boxes or ongoing food boxes that families might need. And then another area is we've really looked at laundry facilities, because if you're experiencing homelessness, you might not have facilities, laundry facilities, maybe you can't afford. And so we're able to schedule time through our own fundraising efforts. We were able to purchase extra washer and dryers, and then people can schedule time to come do laundry with our community health workers on site, free of charge to these families. So that is all that we do, but I would love to have Emily share some specific impact of how that looks for families at our Y.
So a number of the households that we serve are single parent households, and that can increase challenges as far as transportation, work, income, food access, and the ability to afford things from, school field trips to a trip to the laundromat. What we do as community health workers is we work both one-on-one with the family and connect with the schools to help meet some of those needs, and to do so in a way that is honest, compassionate, and discreet. So for one family, we have a mom of an elementary school student. She had a child who died at a young age, and so mom was very protective of her child, wanted to keep her home with her to keep her safe, and therefore was not taking her to school much. The community health worker worked with the school counselor and with mom to kind of reassure her that this is a place that your child can go, your child will be protected here, and was able to convince mom to enroll her child into the YMCA's before and after school care program. Mom was then able to get a job. When daughter turned 10, she was old enough to go to the youth center. So they went ahead and did a tour. Mom had never allowed her daughter to go swimming before, never allowed her to go on field trips before because of the fear. And her CHW explained to her, if you're going to go swimming anywhere, you want to go swimming at the Y. We've got lifeguards, we've got safety gear, we have everything here. And so by going to the youth center, she's now able to go over there and take things like swim classes, go in the basketball gym. And she is thriving now and going to school, and mom is continuing to hold a job. They were also signed up for our mobile market. Food share is something that many of our families already have, but with the cost of food, they often need something to supplement those meals. Another example we have is a father of a 5-year-old. They did not have stable housing, so they were rotating between staying with friends, staying with family, and then paying for hotels when possible. This child was getting dropped off at school at 7:30 and sitting in the counselor's office because dad had to be at work before school started. And so this community health worker discussed with him the option of doing the YMCA surround care. So that way this child, instead of sitting in the office for, 45 minutes, was able to have breakfast, play games with his peers, and, have some fun before school started. And then after school, getting in a good snack before he got picked up, because food is not always accessible when you're hopping from place to place. This child and his dad also signed up for the Y's family basketball program, so they were able to, play games together here. We do provide a trial membership for our clients, so they have 4 months of free access to the Y, and that includes things like our gymnastics programs, our swim programs, our dance programs. And working together with the school counselor, this father and child were able to find housing. We were able to get some financial assistance for the security deposit to support them. And by having access to the childcare, dad can continue to work and afford to pay his rent. So we kind of just help with every area possible. We're realistic with people. We're not miracle workers. We can't find you a house the next day. We can't, help pay off debt, but what we can do is work with you to find any kind of resource that we can possibly find. And we will guide you through that process and advocate for you.
Thanks, Emily. Man, some of those are new stories to me. So that's great. And it really, I think, exemplifies that the efforts of working together and partnering and learning and sharing within our communities. We all know, because we're out of school time providers, how important that program is. But if we really think about how this is helping the family as a whole, because they're able to go to work, have a stable work environment, it's not just the benefit of the children, but it's so the benefit of the whole entire family. So I wanted to leave you with those stories of impact, because it really, all the work that we do really does make a difference each and every day. That concludes what we have. Jill, I'm willing to take questions or thoughts or feedback from anybody, or if you have anything you'd like to throw out there, if people want to put questions in the chat box too, happy to answer any questions.
Great. We'll pause a little bit while people are thinking about what they might want to ask you. And I'll keep an eye on the chat.
Stop sharing my screen.
And if you have questions for Lindsay or Emily or Jenny, you can either unmute yourself or you can go ahead and put those questions right in the chat and I can ask those on your behalf.
Jill, I think, another thing that I'd be interested is, we presented a lot of information. I'd love to hear maybe what people took away from, what they heard from us, what maybe inspired them or something that can resonate with them. It would be great if people wanted to throw something in the chat box. It's always good to hear, what takeaways.
Yeah, I think you ending on those two really quality impact stories is really heartfelt. And I think that also shows the great work of the community health workers who are those liaisons. I love the 4 words that you used: educate, navigate, coordinate, and advocate. I think that is the epitome of a community health worker. Emily, I appreciate the fact that you said you're not miracle workers, right? You're really honest with these folks about, the turnaround of services and legitimately what can and can't be completed. But when folks are in kind of that crisis mode, as you all very well know, it's really difficult to make that next step, or right, to understand what is it that I need to do. So I think having that person help navigate those systems is wonderful. And anytime you can work with community health workers, please go ahead and find those. I know in the Milwaukee area, you have some great community health worker programs. So if you're thinking about, how does that replicate in a different area, Milwaukee is one big on community health workers.
And Jill, I think one thing that also is, even if you don't have a formal position of a community health worker, or you're, looking for that in your community, think about those components of what agencies are there that might be doing that sort of community health work. How do you at your organization or within your program become that community health worker in theory and philosophy as well?
Bridget was able to make a really great point that it's really special that kids always have a safe place to be at with no charge. So I think that's a big thing for parents and kids. So it's nice for parents too. I would like to extend my gratitude one more time to Jenny, Emily, and Lindsay for being here today, as well as to all of you. Thank you for the work that you do on behalf of children and families in the state of Wisconsin. I hope that you have an opportunity in the coming weeks to utilize some of these strategies and share your learning with others. Every little bit helps.